All right, it is 11:03. Today is October 6th, 2023, and this is Coffee with Community Services, which is Alta California Regional Center's weekly service provider meeting. I have already made Michelle a co-host. I'm going to make Jordan a co-host because she's going to share her screen in a bit. We've got some things planned for you. Some of you may be aware we did announce that Rima is no longer a regional center staff, but we do have a contract with her, and she's still producing some content for us. So Michelle's going to work on queuing that up while we do our introductions here for our staff. So I see Odelia on this morning from Community Services. Good morning, Odelia. And I see Sydney on too from Community Services. Good morning, Sydney. And our manager, Michelle, is on. She'll be presenting here shortly. And Beverly and Shauna are on from Community Services. Good morning. And we've kind of heard from Carly already this morning as well. We'll be talking about our upcoming job fair, and our housing specialist, Rhonda, is on. Good morning, Rhonda. And let's see, for Community Services, I see Jolana on. Good morning, Jolana and Tom. And let's see, Client Services Manager, I see Kanisha on this morning. Good morning, Kanisha. And we've got our Specialized Services and Supports Unit Manager, Jordan, on this morning. Good morning, Jordan. And our Lead Community Services Specialist, I see Jason on. Let's see, Leah's on, Ethan's on. Who else do we have this morning? Yes, wave at the camera because not everyone's in the same line with my thing. So when I shout out your name, Kylie's on this morning. Good morning, Kylie, our HCBS specialist. And our other community services manager, Helen, is on this morning. Good morning, Helen. Our associate client services director, Tracy Brown, is here this morning. We've got Heidi from the Grass Valley office, and we've got Catherine from Woodland. Hello, Catherine. And we've got our cultural diversity specialist, Shamir, is on this morning too. We have our intake and clinical director, Camelia, on. Good morning, Camelia. And my assistant, Zach, is here too. So good morning, folks. See a ton of service providers that are logged in as well. Michelle, how are we doing? Are we about ready to be able to share that to start us off?
Yep.
We miss Rima, so this is nice. Thank you.
Can you see the video of Rima? Yes?
Yes.
Okay.
Yes, Michelle. We can
Okay.
see it.
It didn't give me the option to optimize, so I'm hoping that you guys can hear. So let me go ahead and start it.
Hello. Oh,
You hear it okay?
We are not hearing anything. I think you might need to reshare it real quick and try to see if you can hit the optimize at the bottom there.
Okay. Share screen.
It's at the very bottom of the screen.
Mm-hmm.
On the share to the left of where it says share at the bottom. It's on the left-hand side. It says share sound and then optimize for video clip.
It's not letting me. I was able to do it last time, John. I'm sorry.
All right, we're gonna work on that a little bit.
Yeah.
Maybe I'll have you send it over to me because I think I might be able to get it to work in just a moment. So
Okay.
let me do this. I am going to jump over to I'm going to jump over to a discussion with Jordan, actually. We'll jump over to our CRDP priorities while I try to get Rima's video going.
Excellent. So happy Friday, everyone. We were able to meet yesterday. We got all the survey results from our stakeholder feedback for our community resource development plan. So we were able to connect and decide our top priorities that we are going to be proposing projects to Department of Developmental Services. Before I share those details, I do want to remind folks that in regards to the survey results, we are going to be sharing that at our stakeholder public meeting on October 17th. That is virtual. We'll show you that on our events calendar near the end, but let me share my screen and let you guys know exactly what we're going to be focused on in regards to development this fiscal year. Are you guys seeing my page okay? Is it large enough?
Looks good, yep.
Okay, cool. So this is actually going to be posted on our transparency website later this afternoon. But for now, right, we did get a total of 62 survey responses. And in regards to that, and also internal data that we have, right, regarding clients' unmet service needs, our top 12 priorities this year are affordable housing, right, which is some of the multifamily home projects. I know that John has talked a lot about that at CR at Coffee. Financial management services, right? We know that we're in need of FMSs for SDP and participant directed services and social rec reimbursements, right? So that's a big priority for a lot of folks. We definitely have a need and clients that are in need of adult residential facility for persons with special health needs. We also want to continue to try to develop more housing access services. We currently are working on a second vendorization for that, but we're always in need of additional vendors for housing access services. We will look at proposing 2 accelerated dwelling units. Those would be units that would be utilized for independent adults that are participating in supported living services. So that's the focus of that. And we're looking at proposing 2 3-bedrooms. 2 of the bedrooms would be utilized for clients, and then the other room would be utilized for what would be needed for staff or storage or those types of things. We are also in a desperate need of additional day program services. I know for our medically fragile clients, both clients that are at our push-ins, ICFs, right? And in the regards to medical day programming, I know that we could use that. It definitely in outlying areas. I know in Sacramento as well, but we really want to try to focus on our outlying smaller communities, right? With some of this development this year, and not only looking at medical, but some a behavioral program as well. So we'll be working with Michelle and Jason in regards to working on that project and the RFP for those projects. We also want to develop a enhanced behavioral support home, right? Those are intensive services that we used in helping stepping people down from either like a locked state operated facility like Porterville Developmental Center, or maybe one of the STAR stabilization facilities. And also we have clients that are currently in community crisis homes that have stabilized and are in need of step down, right? So some of those people won't need to step down to an EBSH, but several of them will, right? For kind of ongoing, more long-term support needs and training. We also definitely see a need, right? As our clients and are getting older, we definitely see a need for more residential facilities for the elderly. So we're excited to partner with Michelle's team on that one as well. Psychiatric services is definitely a big area of need for our clients with dual diagnosis needs. We are also looking at respite. I know that the community is as interested in site-based respite and regular respite, right? So we'll be looking at a project specific to that. Right now, we definitely have, information regarding the need for more enhanced supported living services. So we'll be looking at proposing a project for that. That will also be working with Christy Schaefer on that one. And we definitely have clients that are still struggling with using illicit drugs, right? And their recovery and trying to stay sober. So we will be looking at proposing some type of training or outpatient services for individuals with substance use disorders. So those will be posted, like I mentioned, on our website. And we'll talk more about the survey results on the 17th of October at the stakeholder meeting. But if anybody has questions, let me know. And John, you might have more you want to chat about.
Yeah, sorry, I did drop in the chat information on the accessory dwelling units, and I know that we've talked about it previously here in this meeting as well. Again, through this process, this is us taking a look at the gaps in our services that we have. Not only do we have a needs assessment process through our regional center, but then we also had the specific community resource development plan survey. And then we also have the experience of all of our staff that sit in and listen to the requests that come in through our committees and try to work with our service coordinators and managers to identify appropriate resources for all of our clients. And when you heard the priorities that Jordan discussed, it sounded like there was a whole lot of them, which we do have a whole lot of them. And I think for our regional center, rather than focusing on, we are looking at one, I believe, enhanced behavioral support home. But in the past, we've done a lot of models of restrictive high level care homes, and those have been our requests. And this request is looking at, a lot of different areas that go on. Again, we already have a number of really high level homes. We certainly have a need for more, but that's not just the only way that these types of funds should be given out. And so last year we did the service to support our deaf and hard of hearing population. We did a home to help support individuals, and not a really, really high level home, but an arm level home to support individuals requiring substance use disorder treatment. And one of the reasons why we're still talking about that is that we still have ongoing issues with our clients and the substance use disorder and the challenges that they're facing. And it's come to a point specifically this year, a couple times, very seriously for our clients. And so we feel like we want to position ourselves as we continue to grow as a regional center to be able to have, more of those types of services available to us as well. So with that, we certainly look forward to the meeting that we're going to be doing. What is that, next week, Jordan? I think.
It's actually October 17th.
October 17th, 11 days from now. And then we will be turning in our plan. So please check our website. You'll see that this gets posted, and then you can give written feedback, or you can certainly attend the meeting as well and give additional feedback.
And next Friday, I'll show folks where this is at it'll be posted today, but I'll show folks where this is posted on our transparency website next week.
Awesome. Thank you very much. All right, and status on workforce survey. We had a discussion about this morning. I forgot to say that we have a meeting with our accounting in the morning, and then we come into this meeting to discuss things. And one of the things that we did talk about specifically was the workforce survey completion payments and when they were distributed. So we heard from Robin that her understanding is that we've distributed everything that we've received thus far from DDS. Is that correct, guys? Isn't that what we heard this morning? Michelle shaking her head yes.
Correct, yes.
So I know that there has been challenges previously with the contractor that DDS worked with, but again, please, you can certainly reach out to your specialist if you have not been able to receive this. You believe that you should have. You've completed the surveys in the time frame that was allotted there. So yes, please reach out to your assigned specialist. We can try to connect with DDS if we need to. That is one of many different type of workforce initiatives that are currently going on right now with the state of California. And so I am going to shift us over real quickly to a discussion of some of the other workforce initiatives, and specifically the big one that I think actually needs no introduction or discussion at all, because all of our vendors already know about it and are already taking advantage of it. But I'm going to share my screen real quickly because we have a couple things. We have the workforce initiatives link, and there's the link right there on, the email address for questions at DDS right there. And I'm going to share my screen real quickly so that you can see DDS's workforce initiatives webpage as well. So everyone should be seeing this okay. And on here, there's information about all of the different programs that DDS is doing right now for the workforce initiatives. Obviously, this took quite some time to get going, but we are now at a point where some of these things are rolling and rolling fast in some cases. And so the Regional Center employee tuition reimbursement, probably not the biggest issue for service providers, but the DSP stipend certainly is. I know that we have had a couple meetings here at Coffee with Community Services where we have provided information about this. I do want to share that the department has continued to provide information for DSPs themselves so that they can learn more information about it. There are recorded webinars that are here, but additionally, we received from DDS information about the upcoming webinar that they are going to have. So can everyone see this link right here? All right, I'm going to drop this into the chat for you all. So if you have staff that are interested in participating in a webinar on how to get paid for this, there is the link right there. I apologize. This just came out yesterday afternoon, and it is for Monday, which for some folks is a holiday. Alto will be closed, but you can reach out here and register and have your folks attend this for the DSP stipend. So we have been, I will say, just like many of the other things that are going on right now, in the last 2 or 3 years, things are being rolled out to service providers at the same time that they are being rolled out to regional centers. And as you can imagine, 21 different regional centers trying to figure out how they are going to work with their maybe 1,000 or more service providers that qualify for this has been a little bit of a challenge because, again, it all happened at once, not necessarily time for us to get a ton of our processes in place. However, at our regional center, we had mentioned that our staff and accounting got together really quickly to develop a process, which we went over with Coffee with Community Services. So I'm going to stop sharing my screen real quickly just so you can see Michelle Duchesne a little bit better. And I'm going to ask Michelle if she can give us just a little bit of an update about what's been going on this week, Michelle, with the DSP stipend.
Thanks, John. So we had an amazing turnout. So we received our first report, and there were 941 DSPs that completed the training. So our team, Raven and Belinda, who are actually attending today, they are my 2 DSP stipend specialists who will be reaching out to all the vendors. So they've already started sending emails out for that confirmation piece. So there's 2 pieces that we need to be able to fund the stipend. The first one is the confirmation email from you guys saying that they are indeed your DSPs and they have completed the training. And that's a simple response to our email, just confirming all of the listed DSPs, or if there's a no, just advising of that. The second piece that's in that email is the stipend agreement sent via Sign Now, that you guys will only have to fill out once. It won't be per DSP. So those are going out. Like I said, it's 941. So they're working as quickly as they can to kind of get those from you. So we also had a few DSPs that were plugging in non-vendor numbers. So community care licensing numbers, or for some reason there was several blanks. So those will be delayed. We have to actually reach out to that direct support professional and get some further information on the vendor name and the correct vendor number so we can fund those. And that's my update, John.
Thank you. And I'm sure this discussion may come up again during the PAC meeting, but we wanted to make sure that you have the update now beforehand, because I think I'm going to be going for the PAC meeting because I'm going to be in Southern California, and I think Michelle might not be there either for the PAC meeting. And so we just want to make sure that folks knew that our vendors seem to have got the message, and they have really come rolling in. Eric, please go ahead. Yes, please.
I haven't taken the training yet. I think I sent some staff to it. Is there any feedback on the content, the quality of the content, for folks that took it or got feedback from DSPs?
I did receive several emails from other vendors saying that the DSPs felt it was very helpful. I know the first one, the Code of Ethics, is about an hour long, and there's several other options, but the feedback is positive, saying that they've learned a lot. It was very helpful. One thing I did miss, I wanted to update you. I know you guys have sent me several emails on questions. I have provided those to DDS. I did receive a response. I think I had 7 questions on there last time. And anything else you guys send through the DSP at Alta Regional, DSP stipend at Alta Regional, we forward. They're still gathering information, so they have confirmed they've received it. So as soon as I get those answers, I will share them at the copies with community services as we move forward for you guys.
I will say next week we are meeting as a group of community services directors statewide, and everyone has been trying to share kind of best practices to make this as easy as possible for the communication back and forth with the service providers. And so right now this is what our process is, and we feel like we've got some staff that are plowing through what we've got so we can get them processed as quickly as possible. But we needed to see what we're going to get next week. If we get 2,000 next week, we may have to reassess things a little bit. We have a lot of people that are DSPs within our 10 county catchment area. And again, the word has gotten out really well. And so we are going to just let you know, we are dedicated to getting this processed. We will certainly, if we need to bring on additional staff, to process these as well. That is our commitment to do too. So there's a number of additional things that our regional center is processing now that we were not processing not very long ago. And this is kind of an added impact because once we process all of that, then the same people that pay all the other bills have to pay this too at our regional center. And there's already a lot of people, for example, that are waiting for social recreation reimbursements that are all trying to get paid by the same people at the regional center. And so all that to be said, we do meet very regularly with our accounting department at least once a week to kind of plan out how we can best ensure that we can meet the needs as quickly as possible for folks. Again, I wish we did have better answers as far as some of the specifics, because I know a lot of service providers have said, I'm just not sure if my staff actually qualify as DSPs or not. And to me, that is like the basic fundamental question to answer. I feel like I have a very loose definition of what should qualify as a DSP, but I just don't. I've also let DDS know that, and we don't have anything necessarily definitive. So we will certainly look to try to get something more definitive next week. Did any other service providers have any feedback that they may have heard from their staff that participated in the training, or any feedback? Again, it seems like it's a smooth process because we've received so many of them, and I haven't heard about a bunch of complaints coming in about people not being able to submit their stuff. So just wanted to give another call for any feedback from folks. All right, can we trust folks will continue to encourage their staff to participate in this? And again, I would love to, think of ways so that you can utilize this to, even better advertise for your vacant positions that you have possibly. All of these workforce initiatives are in essence extra pay and benefits and things that, can be available to your staff. So again, just it's a big undertaking from the regional center to get it all organized. But I appreciate that we're already getting a lot of utilization of it, because you hate having things like this, go through developing a process and not finding people using it. So we're very happy to hear that we know we've got a lot of people that have been getting trained. All right, I am going to try to share my screen, and I'm going to try to optimize my screen for video. Optimize for video clip. I'm going to share screen 2. I'm going to maximize my screen. All right. And are you able to see Rima, folks? Can someone unmute and let me know, because I can't see your videos?
Yes, we can
Yes.
see them.
And can someone also stay unmuted and let me know if you can hear the sound, because I will not be able to know.
Yes, we can.
Hello. Oh,
We
Can't hear him.
can't hear.
This is killing us. Sorry. We're going to have to drop a link and send it out to people via email. I'm not sure what the issue is. I will say too, I will apologize in advance. We are switching over between, I didn't mention this, but we're switching over between our Avaya system over to a Microsoft Teams system, which also threw off voicemails and calls that came in. Some of us are still, or mine is still ringing through our Avaya system instead of through the Teams system. And so I'm getting voicemails via email through it. And so thank you very much, Michelle, for putting that in there. What that also means is that many of our staff are experiencing challenges with utilizing Microsoft Outlook because of our computers over the last couple of weeks, in essence, running both of those systems. And so just wanted to share that with folks that we're having kind of a little increased technical difficulties. Overall, though, I think the transition is very positive for us because it puts us in a position where we can do a lot of the using SharePoint and using all the new cloud-based tools that we have. So, alrighty, Michelle, I don't know, did we have anything else? I don't think about the workforce initiatives that we wanted to touch on too much. I know that we've got some upcoming, I think, information that we want to talk about the DSP internship program, but we're waiting to try to kind of work on our plan on how we're going to roll that out. It was announced at the CDSA conference a couple weeks ago that Alta and Valley Mountain Regional Center are the first two regional centers that are in the first phase of implementing the DSP internship program, which is the paid internship program where you can have a staff person that is, being an employee of record for another company, and they're able to come work for you on a paid internship status, and then you can hire them. The idea of getting a better trained workforce, for some, definitely for those that would come in at an entry level. But we'll be sharing a little bit more information about that shortly. And let's see, we will, Michelle, thank you from ResCare. Yeah, same issue. I think we're hoping to get over it here shortly and get ourselves aligned and used to all of the new systems. I did find out that with Microsoft's Teams, I think we will keep, if everyone's cool, we'll keep Zoom for this meeting moving forward for probably ever, or at least for however long we keep doing this, because everyone knows how to use it and it's very clear. And Jordan already found out in one vendor meeting that if I change the background on Teams, I can make all of us look like we're in a football stadium together. And that's very distracting in a very serious vendor meeting, apparently, that I did to Jordan this week. So I will not play around with that anymore in the middle of a meeting with a vendor where we're talking about serious stuff.
Hey, John.
Yes.
I think we're in contract for like another year to use Zoom.
Oh.
And I think it's going to phase.
Here we go. Well, we'll be at least doing this for this long.
Yes.
And let's see here. So I want to touch on our newsletter that went out as well. And so let me jump over to Alta's website. And I know everyone knows how to find things on our website, but I always like to navigate there. And so let's see if I can get you guys' pictures back. Nope, I can't. All right. So are we seeing our website?
Yes.
All right, perfect. So from our website, we go to Alta Connections, and that is our newsletter. All right, so we have this newsletter, and you can see the newsletter translations that we have here as well. And you can tell I was already looking at it earlier. So let's see here, one moment. So once again, this is our Alta Connections newsletter, and we always do a featured artist on the front of there, and we have our message that we start off with Lori, our executive director, of course. And in this part, we talk a little bit about some of our upcoming activities that we have, and the focus of this edition is our client and family supports. I think I've shared with folks before, but our executive director is the one that kind of sets what we do for every newsletter that we have, the things that she wants us to communicate. And this time around was our client and family supports. And again, we like to share the information from our strategic plan, which you can also find on Alta's website as well. Of course, representing Direct Support Professionals Week and being able to honor all of the work that your staff do and that you all do. And so just talked a little bit about the proclamation there, talked a little bit about the DSP workforce initiatives, the DDS workforce initiatives that they have. And we'll get into some of these, I think, more in future editions. And then many of you reached out to us, and I don't know how many of your guys' DSPs we were able to get into our social media, but I grabbed pictures and put them on a page of our website along with many of your logos for people that sent them in. So thank you very much, folks. It is great to see a group of smiling, hardworking faces of DSPs because, again, you are the ones that do the work day in and day out with our clients. And so we have a feature here on Jason, our lead community services specialist. So if you want to learn more about Jason and his background, please check that out. We have Erlene Gordon and representing on her 90th birthday. And so if you want to see a little feature there on one of our clients, Erlene. Supported decision making. I hope that folks are familiar with supported decision making. And this is an update from our legal services manager, Robin, where she discusses it. And also recognizing, where we as Alta, I think if you looked at our, client advisory committee, if you looked at our board, you'd find a lot of support across the board for supported decision-making in challenging planning team situations, and especially as a possible alternative to conservatorship for folks as well. We have the Sierra College to host a provider job fair. So Carly, don't let me forget, I got to jump over to the DSP Collaborative website a little bit. But again, this is coming up on November 7th. And I know in the very beginning, Carly put the link in the chat to be able to register for that event. please make sure that you do that so you have that free opportunity to be able to have a booth out there at Sierra College. Get people knowing about our industry, please. I think we promised 50 or more service providers, and I would love to have way more than that. This is right in the middle of the campus at Sierra College. Again, client spotlight, Leslie, one of our dog walkers, and talking about her business here. So you can see information about Leslie. And then what we do similarly in this meeting, but also wanting to ensure that not just you as service providers, but our community is very familiar with it as well. Our events calendar is so much more than it was not too long ago. Like we, in the last year, have really stepped up and included a lot of information in there. And I remember specifically in our provider advisory committee kind of talking about this, about creating a more robust events calendar. And I just think that, we're finally starting to see it happen. And with that, if you check out our events calendar and you come find us in the community, you can see one of these awesome events that is put on by Shamir, our cultural diversity specialist, and a number of our different staff that participate in these events as well. I know myself and others, we do a lot of, community outreach and speaking and talking to folks. And, it is always surprising that folks just haven't heard of us or are not aware of us. And so I really commend these efforts, and please check us out at any of these upcoming events that we have on our calendar. Additionally, we have the Supported Life Conference, which is something that you can certainly log into to get more information from here. We did share with folks, I think last week about it, because that was the end of the early bird registration. Rhonda has almost finished our presentation, I believe. We're kind of finishing up some last few slides, but we'll be presenting with the Disability Housing Alliance about working with family partnerships to support housing development. We've got some really cool, exciting things to report, different meetings that we've had with different boards of supervisors, different people from city councils, from different offices throughout our catchment area. So I think it'll be a cool report during and discussion during the Supported Life Conference. Again, we have our resource development updates, new service providers that we've brought on. We've got some closed service providers that we've brought on. And then we have our featured artist profile with Stephanie here as well. One thing I want to, let's see, I have my own hand raised. I don't want to have my own hand raised. One thing I do want to share real quickly, and I know I talk about this at our, I can lower my hand there, that I can talk about this during our board meeting, is that we do have some vendors that are kind of falling off. You're seeing that they are no longer, vendored with us. They're closing out. There's a number of vendors that we're reaching out to that haven't served our clients in years. And we are verifying whether or not people want to still be vendored with us. And if they do want to still be vendored with us, then we need to update their vendor files. That's part of those biennial evaluations that we have to do. If someone still wants to be vendored with us and they don't want to take referrals, that's fine. They just have to keep their vendor file updated so that in case one of our service coordinators does want to use it, then everything is updated. We've got all the updated licenses and everything else. So I know when I see some of the closed service providers, that's some of the ones that are in there are ones that have not served folks in a while. So Michelle, please go ahead.
Yeah, I just wanted to reach out to the vendors. So I have been going to our outlying offices and, talking to our art programs and doing the spotlight. So for our next one, if you guys have any recommendations or the program where an artist would like to be highlighted, I'll put my email in there. And I was, hoping, I think my next plan was to go out to Yolo County, but I'm open to any program that says that there's an artist that's interested. So I'll put my email in the chat for that, for the next one.
I do appreciate we got Neighborhood Center for the Arts this time for this one. And again, we want to spread it around, folks. So please encourage Michelle to come by and check out artwork. And we will need to find someone new probably in the next few weeks. So please reach out as soon as possible as it relates to that. I do want to jump over to the events calendar real quickly, just as a reminder to folks on how to find it on our website. And then I can also jump to questions that folks might have about some of our upcoming activities, but let me go to our website again. And I don't know why, for some reason, I am losing all of you when I share my screen now, but that's okay. Okay, the video thumbnails are minimized. All right, so on our webpage here, if you go to our menu, you can see news and events, and they also have an events and a calendar. So events and calendar, And here is where you can find it, and here is where you can view the upcoming calendar and all of the exciting activities that we have coming up for our regional center. This is also how, if you wanted to attend one of these finance committee meetings or board meetings, you can register for those meetings as well. We have our upcoming provider advisory committee that's going to be meeting shortly. So again, you can see this, you can see our upcoming vendor forums. We do have an ILS vendor forum that I know that Leah's been prepping. So just want to ensure that you folks are aware of this, that they check it out. Jordan already mentioned that we're going to be holding our stakeholder meeting for the Community Resource Development Plan. That's the time to have face-to-face communication with our staff to talk about where the resource needs you feel are with our community, and if you support kind of some of these ideas that we are putting forth with it as well. With that, not many of you are EBSH, CCH vendors, but we don't have that actually on our calendar because it is a smaller group, but that meeting is on October 26th for the Enhanced Behavioral Support Home, Community Crisis Home Service Providers. And is that at 10 a.m., Jordan?
Yeah, from 10 to noon here at Alta
All
in
right.
Brenda Smith. Yeah.
And let's see here. I want to once again, and I didn't mention this previously, but I did want to go over to DDS's website, and they did put out information about the employment work group meeting. Carly, were you able to attend the DDS employment work group? Oh, you were. Cool. I have the PowerPoint from the work group, and I'm going to drop it in the chat if that's cool. And then if I bring up the PowerPoint and share it, can you just kind of give folks a little idea about what you guys kind of talked about in the meeting?
Yep.
Okay, cool. Let me just share my screen real quickly. All right, share. Okay, and then in the chat, I'm going to drop the link to where this PowerPoint is. And then again, the DDS work groups information is also typically on DDS's website. I'm gonna try to make this a little bit bigger. Well, not too big. So you guys had a meeting, and let's see if I can get to you guys' agenda. Okay.
Yeah, so we had the meeting yesterday. Was it yesterday? Yes, yesterday.
It was.
I don't know. Time goes by so strangely nowadays. Yeah, so we had a wonderful presentation on customized employment. I believe the meeting was recorded.
It was.
Oh yeah, I highly recommend going and accessing that recording. It was a wonderful presentation on really what customized employment is, why it's beneficial to add customized employment to your service offerings. And then we moved into
And that was Sarah Murphy that did the presentation?
yes, Sarah Murphy from Transcend.
Cool.
And then we moved into an update on the career pathways to competitive integrated employment. For those of you that remember, we discussed it a couple weeks ago. That is the new service code that they are going to be releasing soon. These are the focus group meetings that they held to get information to inform their decisions for this new service code. They understand the issues surrounding transportation, benefits counseling. Those are the big issues, transitioning from high school to secondary education or employment are really the major issues that the community feels we are facing. So they are aware and they're working on addressing those through the service code. They are hoping that at this point, they will release that service code for use in November.
Cool. And updates on PIPs and CIEs?
So then they went into where we are currently with our numbers in the PIPs and CIE. You can see here, these are the numbers that we have for just the first 2 quarters of the current fiscal year. We're doing really well, getting back to pre-COVID numbers. In some cases, we're already on track to go beyond, well beyond where we have been before. So,
Awesome.
John, if you scroll down, there's a couple of good graphs here. So you can see on this one on the paid internship,
Wow.
even with just the first 2 quarters, we're already surpassing the entire last fiscal year. So definitely by the time we reach the end of the fiscal year, we're on track to have better numbers than any of the other years.
Awesome.
And then CIE, again, this is that 561 number is just the first two quarters. So we're on track to be about where we were last year.
Awesome.
And this is for the ongoing competitive integrated employment. So those clients who were employed for at least 6 months or employed for at least 12 months. Again, doing well for the first two quarters. We expect to, double those numbers essentially.
Whoever created this slide, did not do a good job in statistics class, because that is not a very good way to represent that only half of the year has gone by for that, but whatever. And then the quality incentive program, they went over this stuff as well.
Yes. So they just went over the quality incentive program in regards to ACRE and SEPS training. Again, I don't think they really provided any new information. But yeah, so again, they just discussed the process for submitting all of this. They have previously released the spreadsheets that you will submit and turn into DDS. I believe the deadline to be reviewed for this quarter, I believe they said October 28th. But so they will be reviewing them on a quarterly basis. So if you want to get this, the ones that have your staff that have been already completed it, and if you want to get them paid this quarter, turn it in by October 28th to DDS. Other than that, I don't think there was any new information on that.
And then they wanted to discuss this, whether or not our vendors are actually aware of it or not.
Yes. So yeah, if we can open it up, is there really anyone, and also any additional questions or concerns about the quality incentive program? They were looking to open that up too.
Questions from folks? All right, well, if we don't have any questions about that, that is just fine. And we will continue to give you updates. I will say, after this last kind of budget session, certainly a lot of discussion about the transition from sub-minimum wage. I will say, I don't think we talked about it here, but I have to give Carly her props, because DDS did reach out to Lori and I and said, we really want to have a discussion about the sub-minimum wage transition for folks. And we said, wow, that is really something that we're going to need Carly and Michelle to be present for. And so we met with the deputy director of DDS and did not know what they were going to ask us beforehand about the sub-minimum wage and the transitions and everything. And I just want to say how much I appreciate Carly, because she did such a great job explaining with a depth of understanding about what is going on at our regional center as it relates to those clients, and was able to answer all of the questions, which we absolutely would not have been able to do elsewise. And I say that because I keep mentioning too that employment data is so important, and it's going to be even getting more important, I think, over this next year as well. The department did not have a lot of answers, to the legislature as to why we didn't have, very good handle on how many of our folks work and how many of those folks were working that were transitioning out of sub-minimum wage. And so I think for many of us, sub-minimum wage was going away for a decade, right? So we were not we had already been at the death knell of all of this anyways. It's just, really looking at those individuals and how many of those folks went from sub-minimum wage to nothing. And that is the big concern, is that we have folks that, may have possibly completely lost out. And so I think that is a big focus of our efforts, is to make sure that we've got other alternatives for folks that, are no longer having some of those sub-minimum wage opportunities. So anyways, I just want to really, Carly has taken on a lot of responsibilities in this area. And because it's one of our, strategic focus areas as well, we have a lot of different initiatives that are going on, Sierra College being, a big one as it relates to that too. With that, real quickly, I do want to just go back to the DSP Collaborative website, which I had up at the very beginning of our meeting, and I don't want to go to the chat. I want to go to share my screen. And on the DSP website, the DSP Collaborative website, once again, on the front page, this is the free job board that you as service providers can do. We did a couple weeks ago do a statewide presentation to the California Disability Services Association about this, and certainly a lot of other regional centers are very interested in having the same type of opportunities to be able to have a free job board like this. And we are in the process now of doing additional advertising, both for the DSP Collaborative website and for the upcoming job fairs. So we have 2 flyers. We have one for job seekers and we have one for employers. You can download them. You can share these, one for job seekers, on your social media. We really would like to see that be a very crowded event. Carly, anything else about the job fair that we need? Do we know if we have anyone signed up yet?
Yeah, we have a good handful of people signed up, a handful of vendors signed up. We haven't really started the big social or big media campaign yet for job seekers, but we have a handful of people signed up, but we want a lot more. So go on there right now.
So, you know,
Sign up.
we know that there are certain monies that our DSP Collaborative was able to pull together through HCBS to advertise for these things. And so some folks within our DSP Collaborative, right, recognize that we didn't necessarily have an extra budget to advertise for Sierra College. And so Alta has made a determination to add additional funding to support this Sierra College job fair, just directly from Alta. So with that, again, you know, it is absolutely imperative to our regional center that you as service providers have employees to do the job. You know, we live and breathe by the quality of the DSPs. Carol knows exactly what I was talking about. She was out there yesterday with me with a service provider, and we were meeting with them and talking about just that importance for the quality of the DSPs, because there's so much trust that goes into the care that's being provided because of the needs of so many that we serve. And so, you know, you not having staff, you not having managers that can manage those staff really impacts our clients. And so it is going to continue to be a very important thing for our regional center. And I will say also, you know, we are supporting these workforce initiatives that DDS has. But if there are other things that we can do, I will say some of you service providers, if you are at this point unsure of where you sit with the rate study and where you might land at the end of the rate study, I would really encourage you to reach out directly to your community services specialist. At this point, once we've started giving rate increases to vendors, there really shouldn't be a surprise what your rate is going to be at the end of June of 2024. That being said, we do know that there are some service codes, whether there is ILS through the budget change process that went on last year, or we know specifically from DDS that they have identified infant development programs, transportation providers as possible rates that might need to be modified between now and, or in essence that are currently being studied to be modified. As it relates to like a day program or some of those other types of services, you know, I am not aware of any shifts that are going on. So the rate study implementation information should all be contained within the rate models that are already on DDS's website, and you can, you know, search Alta's directly. We do it very frequently in this meeting. So I just want to encourage you all as service providers, if you are unaware of where you are going to stand, you have concerns about that, please reach out to us and reach out to your assigned community services specialist. If you are not sure of who your assigned community services specialist is, you can reach out to our vendor coordinator, Christine Hobbs. So Christine Hobbs is, you'll see if you get emails from her, it'll now say vendor coordinator instead of office assistant under her name. We've moved away from doing a lot of office assistant type tasks and now are doing a lot more in trying to get all of you vendored as quickly as possible and get all of these quality assurance activities done. And so with that, if you are not sure, we'll drop it. It's chobbs@altaregional.org if you are not sure who your assigned specialist is. All right, so want to check in with folks to see if we have any other agenda items. We do have our Director of Client Services on here, so I assume Michelle Johnson's on. I don't know if Michelle or anyone from Case Management has anything, or if Camellia has anything on from as well. Thank you very much for putting Christine's information in there in the chat. Michelle, anything?
Yeah, this morning, Camellia and I were participated in a webinar related to the ICF carve-in that's going to happen at the beginning of the year. So we're kind of doing our own research at this point and seeing what information is out there. But if we have ICF providers on the line, definitely a change is going to happen January 1st. The change is mandatory. So we are educating ourselves, and then intend to have a dialogue with our Medi-Cal managed care partners, because we want to ensure that they are reaching out or have reached out to our ICF providers to help prepare for this transition. So Camellia and I were on a webinar today. I'm not sure if other folks that are on were also present, but Department of Healthcare Services held a webinar this morning. So more to come on that.
Thank you. I know we had ResCare on. I think Odelia and Scott had participated in some of those meetings previously too, to give us, we'd had a lot of concerns that were raised by our ICF providers about how this is going to be impacting them. So appreciate that update for folks. And again, service providers, concerns, please don't hesitate to reach out. Oh, Christy, what do we got in the chat?
I just added a link to Cameron Park's free classes. They are part of social recreation, and they decided to do some financial assistance to those that live in Cameron Park area, Shingle Springs, Rescue, El Dorado Hills. So if you know of anyone that would be interested in some free classes for kids of different ages, please take a look at their website and that link, and that'd be fantastic. Thank you.
All right. With that, we will be doing a transportation update next week. I think we're going to try to see if we can get Marty on I know I see Letty on here from R&D, but we'll invite Marty to give folks a little bit of an update. It has been very active, my goodness, with the transition over from our previous system to now having R&D looking at the very, very large number of unfulfilled transportation service requests that our regional center has. So we're going to give an update, I think, next week on that Helen mentioned. Perfect. All right, folks, anything else that you feel like you might need discussed or want discussed in Coffee with Community Services, you're always welcome to reach out to us. Zach Horch, did I see a hand go up there?
I did. Adriana reached out to me about UC Mind. There's supposed to be a flyer that Helen's supposed to share.
Aprendiendo Juntos. Is she on this morning?
I saw Helen in the list, so I'm not sure.
Yeah. Okay, so events calendar Aprendido Juntos is on the end of this month. Let me see here if I can find it. It is...
I just didn't want to forget.
Nope, very good. I forgot about that. Helen even reminded me, I thought. I'm going to share my screen real quickly. Learning together, folks. All right, here we go. Here we go. There's the conference right here. This is a Spanish language conference. So if you got the newsletter and you looked at the Spanish version of it, then it would have a flyer for this attached to it as well. So thank you very much for reminding me about that, Zach. All right, folks. Well, I hope everyone has a fantastic weekend. We'll look forward to talking to folks next week. Again, we'll have a transportation update and all kinds of other fun updates.
Yeah, and actually, John, next week, I did want to let folks know that we will have a special presentation by our agency's forensic specialist and our agency's victims advocate about how what their role is and how they support case management and how they could be assistance to vendors if they're not able to get a hold of case management.
Thank you. I forgot about that. Yeah, I mean, for service providers, knowing what kind of forensic services we have, what are some of those other types of things that we can do through our forensic review team, I think it is great information. So they will be awesome presenters. All right. We'll look forward to talking to folks next week. Alta is closed on Monday. Look forward to talking to folks next Friday. Take care. Bye-bye.